Current and former lawmakers to area health care providers.
There are certainly a variety of opinions on today's Supreme Court ruling, and tonight Fox 11's Laura Smith brings us multiple views.
This is a great day for everyone in America. Health care is no longer a privilege, it's a right.
Former 8th District Democratic Congressman Dr. Steve Kagan voted for the health care reform bill. He calls the Supreme Court's ruling a relief.
For me, it was never really about politics. It was about people and my patients, guaranteeing that no longer will people be discriminated against just because they have asthma or allergy or diabetes or some genetic defect that they're born with. So we're now free from discrimination against pre-existing medical conditions.
But some Republicans in Congress disagree with the ruling.
The Supreme Court's decision was unfortunate.
Representative Reed Ribble, who defeated Kagan in 2010, emailed Fox 11 a video with his comments on the court's decision.
This law ultimately will do more harm than good by making health care in America even more costly and dysfunctional. I've repeatedly said that we need to fix the systemic problems in our health care system. But I've also been outspoken that this law was the wrong way to do it.
Meanwhile, physicians in Northeast Wisconsin also have differing views on the Supreme Court's ruling.
There are enough positive things that, we think that the advent of upholding the law is probably a good thing.
ThedaCare Center for Healthcare Values CEO Dr. John Toussaint says healthcare reform is already well underway in Wisconsin. That includes innovations created under the law like payment redesign.
So instead of paying us for doing things to people, which is our present system, they're actually creating payment mechanisms that help us keep people healthy.
Physicians for Responsible Government, a nonprofit organization of Wisconsin doctors, does not agree with the ruling. The group says it's worried about the consequences for patients.
Will my patients be able to receive the timely care that they deserve? Will the environment of medical decision-making remain unrestrained and where it belongs between the patient and the physician without intrusion of government and other third parties?
Officials at Green Bay's nonprofit New Community Clinic, which serves the uninsured, also have questions. While the facility has seen benefits from the health care law in the form of federal funding, officials say they're not sure if the ruling means money will be available in the future.
We're hoping that that will give us, more than a year of funding, because originally it was just a year. So we're hoping that maybe, depending on what's in the act and what they approved and didn't, exactly what the Supreme Court stated, that we might have more funding coming in.
With the court's ruling, the 2010 health care law will continue phasing in as planned. Laura Smith, Fox 11 News.